Welcome everybody to this webinar on the cliff effect. I'm going to hand it over to Chad Sawyer, who will open up the event.
Thank you for attending today's webinar, Less Poverty, More Prosperity, States Tackle Benefits Cliff, organized by the Administration for Children and Families, Office of Regional Operations. My name is Chad Sawyer, and I'm the Regional Administrator for Region 3, headquartered in Philadelphia. I'll be your MC for the first half of the webinar. We have a robust agenda intended to inform, engage, and inspire action. So let's get started with the welcome and introductions by Deputy Assistant Secretary for Policy, Jennifer Canistra. Jennifer?
Good afternoon and welcome to Less Poverty, More Prosperity, States Tackle Benefit Cliffs. I know some of you attended a January 2024 two-day event where 17 states and DC, parent leaders, and business leaders came together for a dynamic discussion on strategies to move forward. We are so excited to build upon that convening today with a larger audience to really dig into ways to diminish the cliff effect and foster dialogue on possible federal, state, and other actions. Your attendance here today shows a continued vibrant national interest across states and regions of the country to diminish the benefits cliff so parents can move up the economic ladder and businesses can hire the workers that they need. Parents are a growing voice for this issue. We are so appreciative that you share your stories and desires to work and we be upwardly mobile. Business leaders are also here, seeking solutions to ensure motivated workers take or stay in jobs. And states are ACF's key informants on what is and is not working in service delivery. Benefit cliffs have often been a stumbling block, just too hard to overcome. But we can't let complexity block action, and we know that this issue involves multiple programs and policies. ACF is committed to both a vibrant economy and a seamless service delivery for families, and we will lean into what it takes to remove obstacles to economic success. Today, we will hear first from parents, then business. We will also hear from state leaders and the Atlanta Federal Reserve on best practices to reduce the benefit cliffs on the state level. States will highlight potential directions the federal agencies and programs might consider, and federal leaders will engage in discussion on all of this. You will have the opportunity 2 times during this webinar to share both your concerns and your questions, and also to share what you need to affect change. So please actively engage in the chat at those points so we can read and know what each of you are looking for and thinking about this critical policy challenge. This event will also be recorded and made available to all of you. We have a short amount of time, less than 2 hours, so we will work to stay on time, to capture information, and to convene future engagements based upon the next steps that you will identify. I'd like to thank Brittany Birkin from the Federal Reserve Bank of Atlanta for her insights and her facilitation. And thank you to the parents and business leaders for sharing your narratives today that really show the heart and the fiscal facts in real time. Thank you as well to the federal leaders who are leaning in on this issue and listening to state concerns. A shout out to Jennifer Brzezinski at HHS, who is looking at cross-sector remedies and innovations. And special thanks to Elaine Zimmerman and Chad Sawyer, who with an ACF team put this event together. The solution to benefit cliffs sits with parents and business at the intersection of federal and state government. We are so excited to work together on this. And thank you again for coming today. And now, Chad, I will hand it back to you.
Thanks, Jennifer. Our first panel discussion is titled, What is the Cliff Effect and Why Does It Matter? Facilitated by economist Brittany Birkin from the Federal Reserve Bank of Atlanta. So I'll hand off to Brittany.
Thank you so much, Chad. I appreciate the opportunity to be with you all this afternoon. First, small correction, not an economist. In fact, that kind of plays into my pathway into benefits cliff, but we're going to start by doing a little bit of level setting on what are benefits cliffs. So the definition and the heart of what we're going to talk about today is when a modest wage increase can result in the partial or complete loss of access to public benefits and actually leave the family financially worse off. As was said in the opening, we're going to hear from a number of parents today. And I often reflect and share the story of the first time this issue was put on my radar. I was serving as Florida's child care state administrator and received a call from a parent. And she said, if I've done my math correctly, was offered a 10 cent an hour wage increase. And for that $200 a year, she indeed was going to lose eligibility for her 2 young children to the tune of nearly $9,000 a year. And so that really got me thinking a little bit differently about how we need to support child and family outcomes. At the Federal Reserve Bank of Atlanta, this is part of our research agenda and actually started as a research project by economists who were really studying the issue and recognized at the time that while there were a number of wonderful tools that existed or in development, there were not tools that focused on the career pathway. So not the immediate change that might occur, but over the arc of a career, a benefits cliff may occur within a year or 2 years or even 3. And so set out to help inform and provide information on when do benefits cliffs occur, to whom might they occur, how do they vary based on geography, based on family composition, and based on the public benefits package that families are accessing. This information is really important. It can help inform policymakers as they think about how to reduce barriers to economic mobility, for community and state leaders that are working on mitigation strategies or innovation pilots. We'll hear a little bit about that today. And for employers to understand the challenges some employees may face, and very importantly to workers. And so I'm going to invite on for our first panel, which will focus on parent and business leaders, April Vaughn, Joe Wesley, Sarah Wing, and Kyle Baltic. And we're going to kick off with April. Want to turn it over to you to talk a little bit about your experience with benefits cliffs.
Thank you. Just want to ask a question. Have you ever been penalized for doing your job? Well, I have. After attending a mandatory training for my job, the penalty for me was loss of benefits. I have a household of 7, with having 5 children trying to make ends meet. I had to make a hard decision from working as a full-time employee to per diem due to childcare. Every ER employee must complete an extensive 4 weeks training to understand emergency response protocols and expand their knowledge of what to do and how to respond due to an emergency. I could have been terminated if I didn't complete this training. My position is per diem, with hours ranging from 8 to 16 hours a week. I was penalized for temporary income. I started this position around my degree determination period for SNAP. My SNAP benefits was cut drastically by 90%, all because I attended the training. I offered a letter from my employer stating that the income calculated on my last 2 pay stubs were due to training and not my contracted hours. I was informed that I would have to wait about 7 new pay stubs to show and provide proof that my increase has decreased. That's 3 months. That's 3 months of me trying to figure out how to provide breakfast, lunch, and dinner for my family. Making sure they receive nutrition values to help maintain a healthy life. With a household of 7, how much nutrition can we possibly get? I had to literally figure out how to make $53 of SNAP benefits stretch. Imagine going to bed hungry and waking up in the next morning, making sure that your children were fed, and you got them off to school, but you were hungry and you had to go to work. Me as the provider, how am I supposed to maintain a healthy life and be strong for my family? The benefit cliff is unjust and it's unfair to penalize me for doing my job, which was temporary, but also mandatory. The reality of this penalty didn't just affect me, but affected the lives that I'm responsible for. I was trying to be even better provider, but instead fell over the cliff.
Thank you, April. Really appreciate you sharing the very real challenges that can be experienced despite families working and trying to make ends meet and advance in their careers. We know clearly this is a significant challenge for many workers, and it also can be a big challenge for business organizations. So would like to invite Joe Wesley from Wegmans Food Markets on to talk a little bit about how this issue got on your radar and your current engagement with benefits cliffs. Joe?
Thank you. For those of you who aren't familiar with Wegmans Food Markets, we're a family-owned supermarket chain that operate out of Rochester, New York. We're currently in 8 states in Washington, D.C. And we have 111 stores currently with over 53,000 employees. We're very proud of the fact we're also consistently recognized as a great one of the companies to work for. And we're proud of that fact. And that really comes from our caring culture and working with our employees. We're, like I said, we're located in our home base is still in Rochester, New York. And we were partnering with the mayor of Rochester, because although Rochester is a great town, unfortunately, we have the distinction of having 3 of the top 5 highest poverty zip codes in the entire state of New York. So from that, we always try and partner with our other folks in the community. And talking with the mayor, we decided to focus on one zip code in particular. So the 14605 zip code is in the city of Rochester. We went back to our offices and said, what can we do to help this issue? So we looked up on our records. We actually have 100 employees that are in that 14605 zip code that work for Wegmans. So we went down further, and 33 of those employees are full-time, 67 of them part-time. So we said, well, let's beef up recruitment and see if we can get more people from that zip code employed. And over the time that we've been working on it, we have added 5 additional people from that zip code. And we were able to take 6 from that 67 part-timers, help them gain full-time employment. But with that, we also hear all of the challenges that come with it. Too many times we have heard from employees that we have worked with that we have a philosophy called learn and grow. The more somebody learns at Wegmans, we want to help their career within the company grow. Part-time employees come in, they work great for us, they do a fantastic job, but there are way too many occasions that we approach them about going full-time. And just like Gabriel's scenario, you run into the benefits cliff that these folks, although they're a great employee, say, I can't go full-time. Well, as an employer, that becomes very difficult because now you're trying to work around all of those things, or you're either trying to find additional employees, or do what you can to help them where you can. And we've talked over the years to elected officials and our friends in government about this issue. And it's not just Wegmans. We talk to a lot of other businesses that are frustrated with the same thing. Folks that they're able to hire, train, grow, and then they're limited in their growth potential. So once again, from the world of business, you know, we just try and do what we can, but unfortunately the benefits cliff, and I'm so proud of being part of this because it looks like we're trying to address it. And again, it's not just Wegmans, but we love to see our employees learn and grow. And the benefits cliff is a big concern for us. It's got to get resolved.
Thank you, Joe. Really appreciate you're sharing how this issue can be a real challenge to employers who want to support their employees and see optimal career growth and acceleration. And as you said, be able to move from part-time to full-time positions. Also know that it can be a real challenge for workers who may want to or feel the need to seek other opportunities and even potentially take on other jobs. So would like to invite Sarah Wing on now to share a bit about her story and experience with Benefits Cliffs. Sarah?
Hi, everyone. I'm Sarah. I'm a single mother of two amazing girls from Maine. I currently work full-time at one of the area agencies on aging in Maine, and I receive benefits. My family is barely getting by, and sometimes we're not. I want to be able to afford things like swim lessons for my kids so they can be safe in the water, or summer camps so they can spend time with their peers. I let my boss know that I was going to be looking into getting a second part-time job to make extra money. I was going to go back to my previous part-time job in the mental health field. I ran the numbers to see what my budget would look like with this extra income, and it looked great on paper, until I found out I would have lost all of my benefits. This is where I was staring over the benefits cliff. My girls get insurance from another insurer, but if we would have lost our main care, it would have been devastating. My youngest is currently battling an as of yet undiagnosed medical issue, which has meant doctors, labs, and specialists for the last 2.5 years. Without main care, her primary insurance would have only been able to cover some, and I would have been looking at thousands of dollars in medical bills just to see what the issue was, let alone get it resolved. The field of mental health lost out on a worker. The field of mental health cannot afford to lose out on workers. They need all of the help, support, and workers they can get. The benefits cliff doesn't only hurt families like mine, it hurts the economy. Overall, if I had gotten this job and fallen over the benefits cliff, I would have been paying out more than what I would have been bringing in with this new job, and I would have added infinitely more stress. I want my kids to swim and go to camp and be with their friends and be safe. Before I close, I would like you to please remember one thing. When you see graphs and charts that show the benefits cliff as a slope or a plateau, it only looks like that on paper. It is called the benefits cliff because when you are living on that edge with the ever constant threat of falling over the edge, you don't see a slope or even a bottom, just the wide open blackness that you are so desperately trying not to fall into. If you could, I would really appreciate some stairs. Thank you.
Thank you so much, Sarah. This is the second opportunity I've heard to hear you speak, and I really appreciate the reference to benefits stairs rather than the steep cliff. And thank you for sharing your story and offering perspective on the real challenges that families do face when facing benefits cliffs. I now want to turn to a colleague at the Florida Chamber Foundation who has done work in this space. At the Florida Chamber Foundation, as you might imagine, represents a number of businesses and business interests, and this is an issue that's been taken up in the state of Florida. And so with that, I will turn it to Kyle Baldwin.
Thanks, Dr. Birkin. I appreciate that. And Sarah, good to see you again. I was on a panel with Sarah back in DC in January, so it's good to see you. The issue of fiscal benefits cliffs was never something that the Florida Chamber of Commerce shied away from. So the Florida Chamber of Commerce Foundation is the research and development arm of our chamber. And if you think about the organization holistically, all of the policy that we go after long-term has first been developed and researched by our foundation, by our economists, by our researchers. But I think our work accelerated actually after coffee I had with Dr. Birkin, who pointed a story to me, a story that she recounted earlier in this conversation about an individual talking to her about whether or not they can take a promotion. And as an economist myself, my thought process on fiscal cliffs, I think, had been a little misjudged. I always knew they were issues. I grew up in a relatively low-income family myself, but I never thought they were stop signs. I thought they were speed bumps towards economic progress, which in and of itself should have been enough to solve. But Brittany challenged me. She said, I believe that there are a significant number of Floridians that are not taking promotions, that are not taking raises within their organizations because they financially cannot afford to do so. And she challenged me to use our outlet to find out if that was true. And so we did. We actually, through a project we were working on, surveyed more than 1,000 HR managers throughout the state of Florida. And I was shocked by the results. More than a third of those HR managers that we personally surveyed responded back that they have personally dealt with employees not taking promotions because they were at risk of losing some of these benefits. A third. And as we think towards economic progress and we think towards growth, we've dealt with these issues in the past. I mean, look at our tax system. Look at the way income tax is taxed. You make an extra dollar, you're not taxed on your entire income based on that new tax bracket. You're taxed on that extra dollar. So one issue we've addressed this past year is the childcare fiscal cliff. In Florida, individuals were eligible for school readiness funding, which was supporting access to childcare up to 85% of the state median income. And what we found is doing a report, access to childcare was the #1 reason parents were actually leaving the workforce, parents with children under the age of 5. We estimate that we are losing about 150,000 parents a year in our workforce due to this challenge. And so this past year, we got some legislation passed that instead of losing your benefit completely at that 85%, we've built in that staircase up to 100% of state median income. And now there is a co-payment, but kind of like our tax system, you're not being punished for earning that extra dollar. We're being slowly moved towards economic progress. So something we're excited to continue working in here in Florida because we know it doesn't just end at childcare.
Thank you, Kyle. Appreciate you sharing both the chamber survey results as well as some of the promising policies that were considered to try and address benefits cliffs. And so, as we've heard, this is very much an issue for workers and families. This is an issue for employers and businesses, and ultimately an issue for thinking about the viability and health of the economy. So with that, I will turn it back to you, Chad.
Thank you, Brittany and panelists, for kicking off the webinar with a great discussion. Now we've come to the first interactive session. We want to know, what are your core questions and comments about the cliff effect? Maya, please open the chat function for people to enter their core questions and comments on the cliff effect. As was mentioned previously, we have a diverse group of attendees consisting of state and federal leaders, parents, nonprofit and business leaders, and we want your feedback on the different types of cliffs and their impacts. Please take the next 2 minutes to type your questions or comments into the chat. You can also read and respond to what other people have written. As Jennifer mentioned in the intro, we'll use your feedback to develop future engagements or products about the cliff effect. Given the time constraints, you can also email your questions or comments to oro@acf.hhs.gov. You might even have an aha moment later while walking the dog or doing yoga, so please email us at oro@acf.hhs.gov. So I'll pause to give you time to type and read what are your core questions and comments about the cliff effect. Okay, and we have a comment from Leticia, and she's a parent in the audience. So as I said, we have parents in the panelists and in the audience. So please read her comment. She's adding to Sarah's presentation and the other parents that we have featured on the webinar. We have another parent statement from Thalia. So please take a few moments to read both those comments from the two parents in the audience. And she said it was like we were thrown off a cliff. So please add your comments and questions. Again, we'll use that to develop future engagements, such as webinars and other products. Best practice sharing by states for the implemented benefit cliff programs. Okay, the comments are coming. We have one from Dion and another one from Nicole. I would love to hear specifically more about how this was instituted and the positive results for families. Transitional benefits would help families understand about how to budget the newly earned income while receiving a reduction in benefits. Thank you, Nicole, for that comment. Okay. Are all states looking into this? Is Nebraska doing anything? From Heidi? Okay, folks just needed to get warmed up. So thank you for warming up those fingers and those thoughts. We appreciate it. Yes, and Kyla is, and sorry if I mispronounced your name, wondering how states are addressing the cliff effect in different states. What are the low-hanging fruits? Okay. All right, so please take the next minute to type and read responses as they are fastly coming. Can you talk about broad-based categorical eligibility and how states can opt into that in order to draw down federal benefits through SNAP and TANF? Thank you for that idea, Tyler. Okay, so take the next 10 seconds to finish typing your core questions or comments. Again, you can email them afterwards at oro@acf.hhs.gov. And thank you so much for the comments and the responses and the interactions thus far. Okay, so Maya, please close the chat so people can focus their attention on our next panel discussion, state action steps and challenges. Brittany, again, will be facilitating that panel, so I'll hand off to her.
Thank you, Chad, and appreciate the opportunity to see some of the questions that are front of mind for our audience. So many of them very aptly tee up this next session and panel where we will hear a bit about state efforts and about innovations that are happening that might inspire opportunities or inform opportunities for action. Before we dive in, want to take the opportunity though to have a parent sort of share with us her experiences both with CLIFs and also an engagement of an innovation pilot. And so it's my pleasure to introduce Quinae Lynch and ask her to share a little bit about her story and journey. Quinae?
Hi, everyone. Good afternoon. All right. I came into DC in 2020 through the shelter program. It was called Virginia Williams with my then 3 kids. After a few years of transitioning, we actually moved into our own home. Shortly after that, I got back into working as a contractor for the federal government. I was very excited. It was more money than I had ever made. I finally thought that, you know, I would be able to take care of my kids on my own, pay some bills on time. And, you know, it's within 60 days, I was cut off from TANF and SNAP. Without warning, no letter, anything. At that point, I only had got 1 paycheck. And then, I had 1 paycheck. And then after that, when I was cut off, it was kind of like a panic because I, had told my kids, mommy's got a job, things are going to be different. We thought we were going to have some kind of normalcy. And when the benefits were cut off without notice, I kind of felt like I was right back at square one because I didn't have my bills set up in time to, adjust to the income that I was now getting. So I was still kind of dependent on the TANF and the SNAP. Food costs were rising, and I have two boys and 1 girl, and their appetites were rising. So I just had to, So I just really had to kind of figure out how things were going to go. And I went to my then my now housing company, which is called Career Map. I have been in there for a year. They immediately adjusted my rent payments. to fill the gap from the loss that losing the SNAP and the TANF. I also received help from them when I did lose the job within 7 months because it was a contractor job. I guess they lost the contract. I did receive help from them getting certified in hospitality, and I used that to now get my new job at a hotel. And but you know, Career Map really just, they saw what happened and they picked up where they could. And Career Map has been such a help to me, just keeping up with my mental health, even helping out with bills far as things that may come up. I can go to them and get help with that. And they have given me the opportunity to be blessed to be able to come and speak to you guys and just give you a window into how the cliff effect affected me and how DC and this program pulled me back up off of that cliff. Recently, I was even featured in the Washington Post telling the same story, just giving hope to people who are experiencing the same thing I'm experiencing and who may have already fell off the cliff and are looking for a hand up or, you know, a hand out from down there. It is possible, and I'm just very glad to be a part of this, and I hope that my story will give somebody hope who has experienced this also. Thank you, everyone.
Thank you so much, Quinay. If you all have not seen the Washington Post article, highly recommend it. It is a great overview on benefits cliffs, features parents like Quinay that are experiencing, tells their stories, but also describes a bit about the Career Map innovation pilot that DC has going on right now. So we will transition, and I'd like to invite up on the panel with me Marielle Lavecchio with the Tennessee Alliance for Economic Mobility, Melinda Kowalski, the Assistant Director for Ohio Department of Job and Family Services, and Bethany Ham, Deputy Commissioner, Maine Department of Health and Human Services. And they're going to share a little bit about their work and their experiences in addressing the issue of benefits cliffs. And so Melinda, actually we'll start with you and ask you what first put the issue of benefits cliffs on your radar, and how did that begin to change your thinking about the administration of public benefit programs?
Thanks, Brittany. So back in 2019, our director at the time came to us and said, we have a benefits cliff issue. We want you guys to solve for it, which was not something that we had ever thought about, or how do you solve for this? So we were also very lucky in that she was very forward thinking. And she came to us and she said, I want you to do a human-centered design approach to the benefits cliff. For those of you who don't know what human-centered design is, it's where you actually go and talk to the people who your policy is affecting to find out what they really need. So we did the human-centered design, and we thought what we were going to hear is that these individuals needed more money, they needed more time. And we did hear that a little bit, but really what we heard is that they needed a person. So how I like to describe it is that my car breaks down on the side of the road. When I'm 30 years old, I pick up the phone and I call my mom. My mom lives 2.5 hours away from me. There is no way for my mother to get to me, but I call her because she is my person that I lean into. They don't have that person. They have no one to champion for them. They have no one to call and say, hey, I need help. We also heard is that they wanted to be thought of more as people. So when you go in to get benefits, they felt like they were just a number, and people weren't really looking at them as a person who has a story and who has needs. Finally, we heard that they felt shame that they even had to ask for benefits, and shame that they even had to be on benefits. So we took that back and we tried to figure out how we could better serve these individuals. What we recognized was that we needed money to provide wraparound services for them. So it wasn't enough just to give them SNAP and TANF. We needed to provide them with mental health, transportation, housing, all of those things that would help them lift them up out of the benefit cycle that they were in and for long-term sustainability. So we started a pilot, and I think I'll pause there because I believe that was probably the next question, correct?
That is correct. Thank you so much. But really want to thank you for underscoring that this is about individual needs. Every family is going to have different barriers, different challenges they experience, and therefore, different supports that are going to ultimately help them advance in economic mobility. And so Marielle would like to invite you next to share a bit about how this issue came on the radar through the experiences of the Martha O'Brien Center.
Yeah, thanks, Britt. So the Martha O'Brien Center is the oldest nonprofit in Nashville. They have a long history of piloting anti-poverty initiatives, and they were implementing 2-generational programming with family-centered coaching, and we're finding that there was a system-level issue that was impacting families, and that issue was the benefits cliff. And so our state created the Tennessee Opportunity Act and essentially decided to invest in community developed solutions to transforming the social safety net here in Tennessee. And with that came some funding as well. So Martha O'Brien Center really saw it as a once in a lifetime opportunity to try to tackle a societal problem, but also to maximize the supports with families in this community. And I'm definitely newer to this space. I was working in out of school time programming and education before this. So I think my kind of entrance point was just looking at the current conditions, but also understanding how things could be different. Like we've heard today from April and Sarah and Quine about their experiences. And I think we did a very comprehensive needs assessment essentially to understand what did families view, what did they think of thriving, what was in the way of thriving, and really centered that perspective so that we made sure to center the voices of those people with lived experiences in the model. And also, I think, in the work over the last 2 years, I've really seen the need for collaboration across agencies and departments as well. And then I think lastly, over the last few months, it's just been a little bit jarring to realize that, we're focusing on trying to support families and moving beyond the benefits cliff because we know it's a key driver of poverty, but there's such a gap between poverty and self-sufficiency in this country. So my hope is that as we consider solutions to this, that we're very ambitious and we really think about the fact that we want to make sure that this solution works for many, many millions of Americans. And since there is that gap between poverty and self-sufficiency, my hope is that we will aim high. And I know that that'll have a tremendous impact on individuals and families and also employers and the economy.
Thank you, Marielle. And I
Yeah.
really appreciate that both of you touched on the human-centered component of this. And Beth, will ask you the same question. And I know that this issue for you resonates both personally and professionally. So can you share a little bit about your work and journey with Benefits Cliffs?
Sure. Thanks, Britt. So my journey with Benefits Cliffs really has come in probably about 3 phases. So lived experience, I bet if I were to ask folks on this call who may have been, who may have grown up in poverty like I did in a single parent family, whether or not you were on benefits as a child or even into your teens, I probably would get several raised hands. So that was my first experience watching my single parent mom try to raise 8 children in poverty and trying to take whatever job she could find, only to have her benefits cut. Didn't stop her from really trying to get out there and make a difference, but it had an impact on us all growing up and what we had to eat for food on the table and clothes to wear to school, etc. So that was my first experience. And then I got into health and human services work at an early age. 19 to be exact, and really came at it from a perspective of wanting to help people and started my career with the Department of Health and Human Services many years ago in the benefit sector in terms of being an eligibility worker. So we probably have some eligibility workers on this call who have taken calls from participants that they were serving and helping, and having them ask, I have an opportunity to increase my hours at this job, or I have a opportunity to take this job, but I want to understand what this is going to do to my benefits. And so that was another aha moment for me about how that the cliffs really where our participants really face those cliffs. And then lastly, I'll leave it here, Britt. And as I have moved up in my career and been able to influence policy more, I've been hearing a lot and have been hearing over the course of several years from employers and legislators about what's going on. Why can't we get folks who are receiving public assistance to take these jobs that we desperately need filled because they're telling us they're going to lose their benefits? What does that mean and how do we fix it? And then I'll end with just saying the work we focused on really generated from a 6-state collaborative spearheaded by the work in our Region 1 Administration for Children and Families. And that really began our focus on tackling the benefits cliffs that began back in 2016-17.
Thank you, Beth. And that's a perfect tee up and segue to getting into the work that you all each are contributing to address and mitigate cliffs. And so, Melinda, we'll turn it back to you to talk about what changes you've implemented to address cliffs, and if you will also share any lessons that you've learned along the journey that might be helpful to other states listening.
Yeah, thanks. So in 2021, we implemented a pilot which included 5 states or 5 counties. So for those of you who aren't familiar, Ohio is county administered. So our counties, we have 88 counties, each of them run or issue benefits and determine eligibility. So we picked 5 counties based on geographic area, based on size, based on where they were in the state. And we told them that they had to have one thing is they had to have a care team, and the care team had to meet the individual where they were at. So understanding back to that human design perspective is that each individual has different needs. So trying to meet each individual where they're at. So the care team could be comprised of anybody, but it had to include a caseworker, and they could include mental health experts, legal, I'm trying to think who else we said, doctors, anybody that was needed to give that person the ability to be successful. We then added flexible funding. So when we have TANF comes with strings, and we all know that. So we had our General Assembly give us GRF, or general revenue funding, to help support this pilot. We also made all of our workers take a trauma-informed training to determine, so that, like we said in the beginning, people felt shame. They felt like they were just a number. So really to bring back the personal aspect back into the casework. So we gave that over to the counties, and we said, you determine the population, you determine how you're going to administer this program. So we watched the counties do this for about 2.5 years. And then we came back and we said, okay, how can we refine this? How can we make this so that it can be expanded? 2 things that we came away with. One is, up until now at JFS, we are very intent on financial gain, financial loss, family size. We didn't really look at the person holistically. So we found an assessment that allowed us to look at each individual across all pillars. And I call them pillars because that's what we call them, but essentially transportation, housing, mental health, childcare, all of those go back to College of Maslow's hierarchy of needs, right? So really looking at everything. What this assessment does is it gives a person a number. So based on all of your criteria, or based on where you are currently, it gives you a number. At the end, that number, we total that number up, and let's say Mindy is an 80. We were able to take those numbers and determine who was right for the Benefit Bridge pilot. So people who had too low of a score had barriers that they needed a little bit more work on. People who were too high in their score probably really didn't need us. They were probably on their way to success anyways. So we were able to use the score to help define it. The other thing that the score is allowing us to do is we have a very number-driven legislature. And so up until now, I couldn't prove success with the program. This has allowed me to show that people who are in the Benefit Bridge program for the state of Ohio and who have a positive exit are seeing a 20-point increase in their assessment score. Those people who are either negatively leaving or are neutrally leaving because maybe they moved to a different place, whatever the reason is, only see up to 1 to 2 point increase in their score. So now I have data to go back to our legislature to say, hey, look, this program is working. The second thing we learned in the pilot one is that we needed to do more of a carrot, not a stick approach. So we needed to provide incentives to individuals for meeting certain goals. Finishing financial literacy, getting your education, getting a savings account. So all of those little things to provide an incentive for, instead of a stick approach, which would be like, well, we're going to take away your benefits if you don't do what we want kind of thing. So we added that into the pilot also. We also asked that the flexibility amongst the population to which they were serving, we really just defined it. So up until that point, counties were allowed to do the program for whatever population they chose. We defined that population by using the assessment score to do it. I would say when thinking about our Benefit Bridge program, the things that come to mind or the lessons that I think we can take away and we can share is one is that the program doesn't move quickly. So with the expectation that you are to implement this program and within 6 months, you'll see an increase in people not being on benefits and people being self-sufficient, you won't. It took us about a year for counties to actually get up and running and another 6 months to a year to actually see individuals graduate. So about 2 years to really see any return on investment. The second thing that I would say that is really important is that a one-size-fits-all approach doesn't work. So creating a program that assumes that everybody has the same barriers and everybody has the same makeup won't work. We really tailor the program to the individual and to the individual's needs, which is a lot of case management, but we feel like that is really one of the cornerstones of the program, along with a peer mentor. So we do require, and I don't think I mentioned this earlier, we do require every care team to have a peer mentor. So that is somebody with lived experiences that can be that person that they call on when they have a question, like, my kid's sick, I have to be at work, I don't know what to do, right? So they call their peer mentor, the peer mentor is like, okay, well, let's talk through this. Call your employer, do all those things, whatever it takes. So the peer mentor and the not one size fits all, it was a huge benefit to the program as well. Finally, having flexibility in funding. So although the GRF that our legislatures invested into the program was a lot, and we only now currently have 11 counties in the program, that flexibility provided us the ability to help people that we wouldn't have been able to help with TANF. So the single male or female who doesn't have children who needs extra help, or the helping them get their credit score in a better place, or child support, the back pay on child support. How do we help them advance those things? So the barriers that people were facing that TANF wasn't able to mitigate, we were able to do it with the GRF funding that we got from our federal government, or federal state legislature, sorry.
No, good. Thank you so much, Melinda. I appreciate your point on, need to think with an individualized mindset, be fairly iterative in implementation and allow time for impact. And also appreciate you sharing metrics and being able to provide evidence. And so, Mary, I want to pivot to you to talk a bit about the innovation pilot that you all have going on and how it is structured, which is allowing for some variation and some learnings potentially about dosage and transitional benefits, which was one of the questions in the chat.
Oh, absolutely. Yeah, thanks, Britt. So I've mentioned Martha O'Brien Center because Martha O'Brien Center houses the Tennessee Alliance for Economic Mobility, and I'm the director of the Tennessee Alliance for Economic Mobility. So we're a public-private partnership with 32 partners that are working in Middle Tennessee. We just expanded to 16 counties here, and we're working really collaboratively to support 900 families in moving beyond the benefits cliff. So we created a pilot called Our Chance Tennessee that essentially pairs every caregiver with a family-centered coach, ensures that they have access to customized resources and also financial counseling that's focused on the benefits cliff. But Britt, like you mentioned, we're part of a randomized controlled trial element. It is actually a required element of the Tennessee Opportunity Act to ensure that there's rigorous evaluation. And so we have 3 different pathways, Dream, Hope, and Inspire. They each have a different mix of services. And so eventually that will allow us to really understand the impact of the high intensity coaching model versus a lower intensity coaching model, as well as the impact of a transitional benefit versus not. So the way our transitional benefit functions is that if a caregiver increases their employment and they end up in a cliff and they are in one of the pathways that are selected for a transitional benefit, then they gain access to an amount of money to sort of help offset that cliff. And so we don't pay the caregiver, which we term our enrolled participants, we don't pay them directly because that would exacerbate the cliffs, but we make direct payments for like childcare bills, housing bills, some health bills that are approved costs. And we also make sure that caregivers have access to fresh food through a partnership here in Middle Tennessee. And so what that does is it allows that caregiver to keep moving forward without that financial impact. I would say for lessons learned, there's so much. We are about 16 months in, and I think the first lesson is just be prepared to learn. Try to work hard to create a culture of learning, growth, and celebration. That can be very difficult to do in government. I know many of us have worked in government, and I just want to kind of applaud the Tennessee Department of Human Services, because I think to the degree possible, they've been endeavoring to support us in leaning into innovation despite, having stringent guidelines. And so the reason why that's important is because this work is so complex and it is so challenging. There are a lot of people involved. Like for us, we operate as a collective impact organization. So Martha O'Brien Center and TAME are the backbone. Then there are partners all across the region. And so staff are hired directly through those partners. It's a big effort to come together in a very short period of time to try to collaborate to support families. So you want to be able to kind of create that momentum so that on those difficult days that we're able to come back and remember sort of the long-term goals that we have. And the other piece around that is that it allows, when you have that culture, it allows you to understand that you can make quicker adaptations. So we've been pretty steady with our model. I would say the largest adaptation that we've made happened in the first several months of the launch of our pilot. We had been doing a good bit of work with partners, and partners had been pre-screening caregivers for this initiative, Our Chance Tennessee, and many caregivers were excited about it. They were familiar with the benefits cliff issue. They didn't necessarily know the term for that, but were ready to go. But then when it came time to enroll, there was a difficulty or a lag in actually taking advantage of the opportunity. And so in understanding more about the caregivers' experiences in our region, what we learned is that it was going to be very difficult for them to take advantage of an opportunity like that, given the various crises in our region. So around childcare in particular and housing. And of course, to engage in something like this with a little bit of steps, it's a study, there's a registration appointment. It was a barrier to access, essentially. So we added $1,000 of client assistance to our model, which was not originally envisioned. And what that's allowed us to do is that caregivers are able to, make progress on some of their goals to increase their self-sufficiency, reduce barriers to employment, but also have some time. Melinda was just talking about that, have some time to establish stabilization to then get into that longer term thinking. So I think the last point I would make, and I think Melinda's shared this around shame and also in her remarks, is that social and emotional experience of families. I know we want at times to say, okay, we're offering this service or we have this tool available, and that, that's the answer. And maybe together as a group of people, we'll come up with some silver bullet. But I think until then, we have to acknowledge that this experience has impacted families for decades, many, many years in some cases. And then in other cases, you have caregivers who have really, this has happened overnight. It's very situational. So there's a whole continuum of experience. There's a lot of complexity, and it really does require kind of honoring that. So I would say if anyone is planning efforts like this, I would say an ideal consideration would be to think about how do we first engage in a lot of awareness raising first about this issue generally before we even are doing something to say that we're asking people to take, a step to actually have a behavior change around it. And then I would want to make sure that I understood that there would be some time to stabilize the family before they're really able to step into that longer term thinking. It's not the case for everyone, but I think in our experience so far, it's an intimidating topic, even looking at your benefits cliffs and where that might arise, and making a plan for it. It's a very, very tall order when you have these other very important considerations that you need to accomplish for your family first. So I think just being mindful that it takes time to build relationships and, collaboration, all that kind of moves at the speed of trust. And so I would just encourage any state that's thinking about doing this work to make sure that there's those elements included in their pilot.
Thank you, Marielle. I appreciate you underscoring the importance again of really individualizing, understanding the family dynamics, building relationships and trust to ultimately be able to position families for growth and economic mobility. And so Beth, want to turn to you now with the same question and opportunity to share about the changes in Maine that have been implemented to address cliffs, and what key lessons that you have learned that you think would be a benefit to others as they're thinking about similar work.
Sure, thanks, Brett. Well, I think I mentioned it when I most recently spoke, and that is the work that we've done in New England with the 6 states in our two-general family approach to jobs. And one of our key focuses has been on the benefits cliffs. And so what we decided to do here in Maine is to first study it. And I would highly recommend that you do that. Study your policies that you currently have in place to analyze just exactly where those cliffs are, and also you'll be able to see where the most severe cliffs are that face families. So that was really helpful for us to help to begin to shape or to advocate for policies at the state level, as well as to dive in with our federal partners to see what we could implement here in Maine that would help to reduce those benefit cliffs. And so some of the things that we embarked upon, again, informed by that analysis, is that we implemented with some key legislators across party lines some key policy changes to our public benefit programs. So we implemented a TANF earned income disregard, and that is 100% of earnings are disregarded in the first 3 months, and then it's phased down after that. We also eliminated our TANF gross income test. We also implemented what's called a TANF worker supplement benefit. So when individuals transition off a TANF, there is a benefit of $100 that they continue to receive so long as they're still on SNAP. We also worked with our federal partners to really dive into what transitional benefits can we embark upon or increase or make changes to that can help support that transition from benefits into economic stability. And so we increased our transitional transportation eligibility. We also the state also passed legislation to increase our state earned income tax credit. As part of 2 big bipartisan policy initiatives, there were 2 policies that were passed. They were called LIFT and STEP, all meant to help alleviate the cliff effects. And so it was great to see those policies pass with complete bipartisan support across the House and Senate. So we were extremely pleased. They got it. Our legislators got it. They know, they heard us. They had more awareness of the impact that it had on families and employers. A few other things that we did was to establish, as part of the LIFT legislation, a program called HOPE, Higher Opportunity Pathways into Employment. And that really is a catalyst to help families enter into higher education opportunities and have them paid for. And so this program has been highly successful in the state of Maine because individuals need that higher education opportunity in order to be able to advance and become economically stable. So that was a huge success and continues to be for families. It wraps around, supports childcare, transportation, payment for educational opportunities outside of tuition and grants. We increased our SNAP eligibility income limit from 185 to 200%. We added job retention supports for our SNAP ENT program for up to 12 months post SNAP eligibility. We also increased our child care eligibility. Our subsidy is at 125% of the state median income. And we increased transitional child care to 250% FPL. We took advantage of state options in the Medicaid program to have continuous 12-month transitional Medicaid eligibility. And we've also increased eligibility up to 300% for children in our state. We have a transitional food assistance program. Again, if states aren't taking advantage of what the federal programs can provide us or provide you, please do so. They are willing to help you, give you the TA in order to get over those complexities. But one important thing that we also did was we partnered with the Atlanta Fed, and we're one of the first handful of states that implemented a benefits cliff tool. So that tool is meant to really coach individuals and families to really get a bird's eye view of where those cliffs are. And while Sarah so eloquently described that those graphs can't really represent exactly what families feel and go through, they are definitely a tool that help families understand what career pathways they would like to pursue based on where those cliffs occur. And so some of the things that we did learn is that you need to carefully analyze where the cliffs are in your state, as I mentioned, but you also need to be careful not to create unintentional consequences based on those policies that you're seeking to implement or change. And I raise that because we did learn that the TANF earned income disregards had a negative effect on families. And the example I'll give quickly is that as they transitioned to the lesser disregard, they got less of a TANF benefit, but ultimately on the flip side of that, it counts towards their 60-month limit, even if it's a small benefit amount. And so we made some tweaks to that policy so that we wouldn't inadvertently do harm to our families. And also, we also have a child care wage supplement that was passed. So if you're a child care worker and you work at a child care center, you receive an extra stipend, an extra wage supplement monthly. And what we're learning is that folks are concerned about the benefit cliff. And that's not a surprise to those of us who have been working in this field for a long time, that Although the intention is good, and I think it really will have an impact on a positive impact on families, there is fear coming from those families that they're going to go over these cliffs. So we're working hard to mitigate those. And cross-agency work is key. Work with your departments of labor, your workforce partners, your philanthropic partners, and your federal partners. Engage with them often and get them at the table. Leverage your policy influence to raise awareness, to gain buy-in with your policymakers so that they understand where those cliffs are and how they impact families and employers. Because we've heard a lot from employers, and you've heard from some employers on this call today. And consider policy reform that doesn't create complexities that are hard to implement and confusing for participants. And I will just harken back to what Jennifer said early on when she opened us up, and that is, don't let complexity block action, but you can be mindful and you can be creative in how that can best benefit and how best benefit families, and how they can be easily navigated. So I'll leave it at that. How's that?
Thank you. That was amazing. I appreciate you very much, and all of you for sharing the work. And what I would reiterate that you all alluded to and you finished with, Beth, this is very complicated. Different families accessing different public assistance programs with different career goals and different needs. And yet what you all have very effectively modeled is there is a path forward. There are opportunities to create change through innovation and pilots, or change through practice, and how we work with families, or change in actual policies that may mitigate the barriers. And so with that, want to just thank you all again. You're very gracious as always with your time, and being willing to share, because together we're all on a learning journey, and there's opportunity to really learn from one another and how that might inform future changes. So thank you again. And Chad, I will turn it back to you.
Thanks, Brittany, for your exceptional facilitation. And thank you, panelists, for another great discussion. Our next session is States Federal Feedback Loop, co-facilitated by Associate Deputy Assistant Secretary for Human Services Policy, Jennifer Brzezinski, and Regional Administrator, Elaine Zimmerman. I'll hand off to my wonderful colleague from Region 1, Elaine. Elaine, take it away.
Thanks so much, Chad. That was just so stunning to hear from 3 different states and to see the models. And we're told again and again that it's impossible to fix this because it's so complicated. And to Brittany's point, this shows otherwise, and that we can go from complex to simple if there's a political will. And this next panel is going to precisely do this. So I'm going to share the process here. We had a meeting that was really staggering in Washington, D.C., where 18 states and 1 district came together in January to talk about this in depth for 2 days. And federal leaders came and listened to what the states were describing as the opportunities, the questions, and the obstacles. And Melinda Kowalski from Ohio, who you heard from, and Peter Hadler, the Deputy Commissioner from Connecticut Department of Social Services, had the ridiculous task of summarizing all the information from the 18 states and 1 district, the themes that emerged, because the conversation was so robust and so textured, and this issue is felt across the country, urban, rural, suburban, that they spent an evening taking all the information from 1 day and turning it into themes and presented it to federal leaders for a discussion. We're going to sort of bonsai that event into 25 minutes. What's going to happen is Melinda and Peter are going to share those buckets of what the state said. And then we have some federal leaders here from different programs and agencies. And Jennifer Brzezinski is going to call on them to share their insights. So I have the opportunity first to dive down into the states and to ask Melinda and Peter to kindly share what were the themes, what are the core pieces that we need to understand. And then we'll hear from some federal leaders who will just ponder out loud about thinking about possibilities. Take it away, Peter and Melinda.
Thanks, Elaine. I'll happily kick us off, and Melinda and I can go back and forth and discuss a little bit of the things that we raised, as you just eloquently recapped from our meeting in January. Again, we really appreciated that opportunity to be able to sit together as states and to interact with our federal partners. This is really work that does sit at the intersection of state and federal government. I think that was said earlier, and I really do truly believe that. And through that partnership, we're able to effectuate change that really makes a difference for both families and employers in this benefits issue. So when we met in January, we really talked about how excited we were collectively to be able to implement family-centric solutions, incorporating families' voices. Even if we have to work within programs to be able to do the work of putting together the social safety net and helping spring families into economic success. And I think we all think that if figure it out together, there is really a win-win proposition to be obtained here for both for families, employers, for states, and government. And so when we identified the themes in January, we found 3 general areas that we thought would be great for states and our federal partners to work together on. The first one was program and policy alignment. The second one is cross-agency work to support innovative solutions to the benefit cliffs, and also opportunities for open communication between states and our federal partners, and federal program guidance that is informed by states' experiences, doing the work on the ground of trying to bring all of these programs together and deliver them in a consistent manner for our residents. So I'm going to turn it over to Melinda, and she can kick us off with the program and policy alignment and what we talked about and what we're thinking in that space.
Yeah, thanks, Peter. So as Peter said, we talked about program and policy alignment. One of the huge barriers that we were seeing is that there's no eligibility coordination. So it's hard to understand cliffs and create solutions when different types of incomes or incentives are treated differently across the different programs. So we really would like an opportunity to do more alignment across those programs. It would be easier for the client. It would be easier for the caseworkers to create continuity and consistency across them. Another example is we'd love to figure out a way to ensure that the benefits remain even if somebody receives an incentive. As you heard earlier from one of our participants, they mentioned that they had to go to training and they got extra money and they lost their benefits because of the extra money. Is there a way that we can prevent that and allow people to still remain on benefits, but also give them incentives to increase their pay, increase their hours, whatever it might be?
I'll touch on another area that, again, that second theme of cross-agency work and supporting innovation. For example, we want to be able to make changes that intersect across different federal agencies, and sometimes it's hard to bring multiple agencies at the state level together, and the same is certainly true at the federal level. But we love to be able to explore some opportunities for making changes across programs that can support working families. For example, we were thinking about, would it be possible for us to set up a multi-program waiver for continuous eligibility or a steady benefit across programs for a period of time, for example, say 2 years, and allow parents to participate in employment programs in in-demand industries such as childcare or personal care? If we stabilize the floor for families for a period of time, we think that could really help spring them into these in-demand careers and meet the demands of so many folks at both the state and the employer level, and of course, put families on these career paths to be self-sustaining well into the future. And we're struggling to do that right now. And I think that Beth referenced this in Maine. We ran into the same challenge for us in Connecticut, where we tried to make changes within our TANF program to be able to exclude more and more earned income to allow people to stay on the program with the rack of supports that we offer through that assistance program. But in doing so, which we think really will help our families in TANF, we have actually caused another cliff to be undone in our transitional benefit assistance program that we have for SNAP. And we sort of improved made the cliff lessened in TANF, but we took away inadvertently part of the cliff mitigation that we would be able to offer for our SNAP families. So we're really looking to work with our federal partners to see whether there's an opportunity for us to think holistically across programs to be able to make changes and experiment at the state level and do innovation in that space.
So one of the next themes that we talked about was the opportunities for open communication and guidance. And we believe that this goes across from federal to state, across state agencies and departments, and also down to individuals. But one of the things that we recognize as a barrier is that we need clarification on data sharing and when it is allowed and when it's not. For example, here in Ohio, we make the client sign if they are getting WIC to let us know that they are a WIC participant so that we can get the data in the SNAP TANF world. However, we heard from other states that they don't do this, that they just share the data back and forth. When we asked for permission, we were told we weren't allowed, but the other state was. So really just clarifying what is allowed and what is not allowed to help create consistency in getting people what they need. We also are all working towards the same goals of economic sufficiency. However, we all have different metrics. Is there a way for us to determine a metric that identifies how a person is cycling in and out or not cycling in and out so that we can better determine what services are supporting that person in long-term self-sufficiency?
I'll just quickly chime in with another example where we're really looking to get some additional guidance at the state level. For example, around data sharing. If we can identify where we can share data across certain programs, it'll really help facilitate a better client experience and help mitigate cliff simultaneously. For example, we would love to be able to use Medicaid data to help confirm eligibility enrollment for LIHEAP energy assistance programs. But we haven't been able to do that to date because it's not specifically identified in the federal statute or regulations that govern LIHEAP. So if we could get clarification that in addition to the programs that have already been identified as potential sources of income match, could we do this using Medicaid data as well? Again, this would streamline the whole process for families and ensure that they've got a stable floor to be able to build off of. And another great example would be able to use SNAP data for purposes of Medicaid eligibility. Again, when people don't ever have to face the cliffs because we already know so much about them, that we can ensure that they have access to these core programs. There's so many benefits to be reaped from that approach.
And then finally, when we're thinking towards the future, I know I just had a meeting last week around AI. I'm sure every state is having these same exact meetings. However, at this point in time, we have no federal guidance on AI. So really, if the agencies could work together to give a common guidance on what AI practices the states can implement and which ones they do not want us to implement, that would go a long way for us as we move into the future and move into what AI can do for us in a positive way. Overall, though, in January, the experience was great. We got to see what brilliant work other states are doing, and that we understand that this is not just a state by state issue. This is a collective we issue, and that really to create the infrastructure and to promote economic sufficiency, we all need to work together to come up with resolutions and to work together to come up with solutions that long term have an impact on individuals. So we today hope you understood what we were trying to say, and we hope that these buckets, you feel the same way that we did in January about where we think that we can work together to create efficiencies.
Yeah, Melinda and Peter, thank you so much for that summary. I would like to tell people that we've had a sort of barrage of people trying to get into this webinar. There were over 360 signed up, and for some reason it's lidded at like 120 or something. But what you see, and we'll send all this information, we'll send the webinar to everybody who wasn't able to be part of it. But what you can see and what we saw in January was there's definitely a shared constituency across the country of parents, business, and states really leaning in to come to the resolution. And so I'm going to hand the baton over to my colleague, Jennifer Brzezinski, who's going to have a conversation with some federal leaders about Melinda and Peter's suggestions.
Thank you, Elaine, Melinda, and Peter. And yes, I think I would add my federal colleagues and I to that list. I think we are always, when we have the chance to talk to our partners in other sectors, and especially parents themselves, so inspired by the passion and creativity that you all show. And we are also, I think, really committed to addressing this issue with everything that we can. So I am excited to hear from some of my colleagues. I'm going to start by turning it to Deputy Assistant Secretary Jennifer Canistra, if you have any thoughts or reactions you'd like to share.
Yeah, thank you so much to, Peter and Melinda and to everyone who has previously spoken. In particular, I think just hearing the real life kind of stories and implications, just, kind of ground everything we're trying to do. So I just want to, say a huge thank you, for parents sharing what they're facing, and then for all the states who contributed. I really appreciate the 4 areas you highlight: program and policy, cross-agency work, open communication guidance, and then certainly AI. I think, some of it is like we've been doing a lot of work in the federal stage on a lot of these topics. For example, on data sharing, trying to make it clear what's possible or not. I've been taking copious notes of the specific examples that I've heard, both from parents and from states, just to make sure we can circle back when we do have a resource that could be helpful for you. But also at the same time, you've lifted up so many great ideas that I want to circle back and make sure that we can address. I think, it's a complicated topic, and there's so many different programs and policies. If we could start over, imagine if we could start over and just think through how to coordinate these benefits instead of all these separate statutes, et cetera. I do think it's a bipartisan issue. I think the fact that we have business at the table, that we have parents, that states recognize it, gives it a lot more potential. And, many of you know this, but, the process to make statutory changes involves Congress, involves the budget process. At least here at HHS, we're starting a new round of thinking about the FY26 budget and what proposals we can put forth to include in the president's budget that then ultimately, our goal is that Congress would pass. And I'll just say, a lot of the ideas that you've raised on the cliff effects, we are taking into account as we sort of think through proposals. So I think the January conversation, of which, I know there was a report after, we took a lot of notes. I've taken a lot of notes today. It's multi-step, but I think everyone is on the same page of wanting to make change, and it's just, getting the information from states. So if you, for anyone listening, not just to the panelists, if you have other examples of, ways that you find challenging for policies and programs interacting within HHS, but also within other agencies, please reach out to us and let us know. I think that's, would be a huge help. And then we'll circle back, when we may have guidance, whether it's on data sharing. There is AI guidance that is forthcoming. So I heard that loud and clear. We'll make sure to circle back and share that, but just appreciation for everything that's being raised on this important topic.
Thank you so much, Jennifer. Let me also turn to the Deputy Director of the Office of Family Assistance, Lashera Ayala, and I'll open the floor to you.
Thank you, Jennifer, and good afternoon, everyone. I want to echo the gratitude to Melinda, Peter, and all who have contributed thus far to the webinar. So as I was reflecting again and thinking back to January on the thoughts that were shared, some of the things that I am considering includes under the cross-agency work and innovation, ways that offices like the Office of Family Assistance may collaborate with colleagues at the federal as well as the state level and lift up information. So, Peter, as you were mentioning, experiencing when decisions are being made on how to best support clients, and then the results of, maybe supporting it in one benefit area and then seeing as a result that another area has now succumbed to issues related to the cliff. And particularly with the TANF program, I was thinking about how we may within OFA lift up information regarding supporting a program. So as an example, childcare, how states may use TANF funds to support childcare, understanding that within the TANF program, that's one of the first benefits that once income comes into a home, families are no longer eligible for. But the use of TANF funds can stretch quite a bit to support those other supports that provides the benefits for families as they are continuing to have upward mobility in their economic status. In addition to that, also was considering along the lines of the open communications and guidance piece, how within TANF and within OFA, we're currently, as a result of the Fiscal Responsibility Act, considering how we implement the new TANF provisions and considering some of the other programs from our federal partners, such as WIOA, wanting to ensure that we align our measures. So when we're considering how we define those measures, not having them be too far off, but considering that, considering SNAP employment and training, so that as was discussed, those measures are quite similar. And also with streamlining benefits and eligibility, prior to having the opportunity to serve currently in the federal level, I worked at a state, and we did have legislation that was passed in which we are able to streamline eligibility. And once a household is eligible for Medicaid or SNAP, they're automatically enrolled into LAHEAP. So for me now, being on this end on the federal side, it makes me think about, how can I have those conversations with my colleagues in the Office of Community Services? How may we lift up those, scenarios where it has been quite beneficial when states have made those decisions, and to ensure that we're able to share those helpful lessons that have been learned through those experiences. And also, as the Deputy Assistant Secretary mentioned as well, with the artificial intelligence and the guidance, one of the things that we are working on in the Office of Family Assistance is what our guidance will be to states, and we're not doing it in isolation. We are ensuring that we're working with our colleagues in CMS as well as FNS, so that when that guidance is released, it is in a fashion that does consider all of the respective programs. Okay, so thank you for the opportunity to share those thoughts.
Thank you, LaSharon. Picking up on the theme of cross-departmental collaboration, we are also fortunate to have Laura Griffin, who is the Chief of Staff for the Food and Nutrition Service at the U.S. Department of Agriculture with us. Laura, do you have some thoughts and reactions here?
Yes, thank you. We are also working on guidance or framework around artificial intelligence, and glad to be collaborating with our federal colleagues as well. We're hoping to get that out this month. I did want to there were some comments in the chat about broad-based categorical eligibility. And so I just wanted to mention that that is one way that is a state option for states to mitigate the cliff effect. Households with income just above the federal gross income limit, but who have high dependent care or shelter costs, can continue to receive SNAP as they work towards self-sufficiency in these states that have aligned their resource limits and gross income with the TANF programs. So the broad-based categorical eligibility is a policy which makes households become categorically eligible because they qualify for a non-cash TANF or state maintenance of effort funded benefits. There's currently 44 states using broad-based categorical eligibility. Many of them have raised their gross income limit to 200% and have no limit on assets. Another important factor in SNAP that I wanted to mention was the job retention services, and Bethany Ham from Maine mentioned that they are using this. They are one of the trailblazers on this topic. Job retention services are offered through SNAP ENT, and they are critical to help ease the benefits cliff. These services are available after clients leave SNAP if they are enrolled in employment and training. These services can include case management, job coaching, dependent care assistance, and transportation assistance for 90 days per the statute. But like in Maine, we can grant waivers to states that would like to extend this time frame up to 365 days. And I was part of the panel in January, and at that time, there were 2 states that were doing this. It was Washington and Maine. And even since then, we've added 2 more. Colorado has extended it to 365 days, and Rhode Island has a waiver that just got approved like last week to extend the upper time limit to 180 days. There was a particular note in the chat about Missouri and broad-based categorical eligibility, BBCE for short. And I just wanted to let that commenter know that we have been providing technical assistance to Missouri with their particular situation and adopting that policy and trying to give them the assistance they need to make decisions about how to work through that. The last item I want to mention is we do have the transitional benefits alternative in SNAP, which is a state option to offer transitional benefits, SNAP benefits to households that are leaving TANF. It provides them with a set benefit amount and eliminates reporting requirements during the transition period. So they can receive benefits for up to 5 months equal to the amount that they received before they ended their TANF. So those are the 3 tools that we're really encouraging states to think about in easing the benefits cliff, because one of the, in SNAP, it's really difficult for us to waive income because the law specifies which income sources must be counted. And this provision cannot be waived. So we don't have a lot of flexibility in what sources of income we can, count or not count. And that's why we're really emphasizing these 3 other strategies. So thank you for the time, and I appreciate the comments this afternoon.
Thank you so much, Laura. That was really helpful. And now for the perspective from the Department of Housing and Urban Development, I'll turn to Ruth Jones Nichols, who is Senior Advisor for Strategic Engagement.
Thank you, Jennifer, and thank you to the parents, businesses, states, and federal partners who are participating today. And certainly thank you to the Administration for Children and Families for the opportunity to join this convening, particularly since I was unable to join in January. There have been so many wonderful things shared today. And one thing that I would like to lift up is that last year, under the leadership of Secretary Marsha L. Fudge, HUD released something called Bridging the Wealth Gap. And this represented our economic justice agenda that would help renters from low-income families build assets. Within that economic justice agenda, we recognize that the requirement to recertify income eligibility on an annual basis is one contributing factor to households experiencing the benefits cliff. And so we have proposed as part of that agenda, and we have proposed for a few years now, that the Department of Housing and Urban Development would receive discretion to allow public housing authorities and multifamily property owners who receive project-based rental assistance through a housing assistance payment contract to implement triennial recertifications as opposed to annual certifications. We know, though, as you have pointed out so eloquently, that if in fact that legislative proposal is approved, there would need to be a great deal of coordination across agencies at the policy and program level so that individuals and households do not experience the unintended consequences of such a legislative proposal. That said, we believe that the approval of the proposal could be transformative. If individuals have an opportunity to increase their income over 3 years, build their savings, reduce debt, build wealth that could even be used for down payment of homeownership opportunities. And so want to lift that because it is something we have been working on for several years, as I indicated, and what is required really is not just the program and policy alignment to get us across the finish line, but the political will at the federal level. So we invite you certainly to share more with us after today and others about how you believe that type of proposal could be impactful at the state and local level. But that is something that we have been prioritizing and certainly leaned into under the leadership of Secretary Marsha L. Fudge. Thank you.
Thank you very much. And finally, another critical partner here, the Department of Labor. And we have Kimberly Vitelli, who is the administrator of the Office of Workforce Investment.
Hi, everyone. I'm also really grateful for the state input here, and I won't claim to have all the solutions. I did want to speak in particular to the program and policy alignment that Peter and Melinda lifted up. When a state is trying to adjust state or federal policies, it's good to know like what kind of tools you have to be able to be flexible and make changes. And I can speak to that for some of the DOL funded programs such as the Workforce Innovation and Opportunity Act, which we also call WIOA or WIOA. So we've got some tools for that kind of flexibility. One is sort of a mindset for innovation and change that our acting secretary, Julie Su, calls Yes, WIOA Can. DOL has issued a couple different pieces of guidance that remind states and grantees and reminds us about the flexibility that already exists in current law to help workers and job seekers get the good jobs that they need to sort of shoot up the career path and not be subject to benefit cliffs. So these pieces of guidance say things like that workforce funds under WIOA can be used pretty broadly, like it's okay to do outreach to people that need services but don't know how to reach an American Job Center. It's okay to deliver to offer supportive services so that people can complete training. That training can be in like a couple different types of modes that and that you can serve people quickly instead of making people crawl through glass. There's even some eligibility criteria that people can just prove through self-attestation under our program and our regulations and guidance. To Peter's point about communication, these guidances were really created in response to some specific feedback that we got from states and local areas and listening sessions. So just +1 to the importance of communication between feds and states and local areas. And I know that we need to sort of keep working on that, not just say it once, but really keep focused on it. None of the guidances that I just named really required any new legislation or regulation. It did take ETA, the Employment and Training Administration, really taking an inward look to make sure we were living up to the flexibilities in statute, and also to sort of call out to our states and local areas that they can do the same. Of course, many have been, but really encourage and create space for everybody at the federal, state, and local level to take a look at their own workforce policies about where we've put barriers in place that actually aren't required to do that. Sometimes the statute really is the problem. States can also ask for waivers under WIOA. And in fact, if you're a state, some of you might have already asked for those waivers in your most recent WIOA state plan, and we'll respond to all of those within 90 days of submission. So if you're a state that has been trying to line up workforce funding and human services programs, and you wish that WIOA was the program that could bend a little bit, you can submit a waiver, even if you didn't already put it in your state plan. You can accept we accept, and you can submit a waiver at any time. There are some limitations in the statute about what we can and cannot waive, but it's pretty broad. So, we can definitely have a conversation about what we can do. Depending on what you're trying to do, the Performance Partnership Pilots P3 might also be a solution. It's a provision in appropriations law that allows local areas to get a little more flexible in a couple different funding streams when they're serving opportunity youth. There's some limitations in the statute there as well, but if it might be a tool that you can use. And just to say it again, the changes that states and local areas want to make don't always require a waiver to change a statute or a regulation. They don't always require P3. It's quite possible that yes, WIOA can do what you want. And when we're the ones getting in your way, don't stop letting us know that so that we can have a conversation about it. Thanks so much for letting me join today in this conversation.
Thank you very much. That was really helpful. And I'm gonna end it with my colleague Nina Chen from the Office of the Assistant Secretary for Planning and Evaluation. If you could say something really quick, Nina, that'd be great.
Yeah, I just wanted to say that from the January meeting, one of the things that states had asked us to do was to put together a flexibilities and waivers resource where you know, from the federal side, if we could publish something that says this state has done X and therefore that suggests that, you know, other states could do it too. So I think taking Peter's example, that this particular state has shared data across, I think he said WIC and SNAP, and Ohio wants to do it too. If that gets published from the federal side, then that would make it so much easier from states, for other states to do those things. So that's something we're working on. And I've also heard a number of ideas from Beth and Marielle and Melinda on this conversation for things to consider putting into that resource. So thank you so much.
Thank you so much for such a stunning panel of you're just all leaning in as leaders, and we are seeing the federal state intersection that Das Canestra talked about early on. If we as parents, business, states, and the federal government don't do this together, it's simply not going to work. So thank you so much. I'd like to take this moment now to ask those who are in the audience listening to share in the chat. So what's next? What would you like from your vantage point? For example, would you like to know how to partner with parents? Would you like to know how to better partner with business? Would you like to hear and learn best practices in the Cliff Effect on the state level? Would you like cross-sector technical assistance on the Cliff Effect? If you'd be kind enough to use the chat as a sort of polling device to share, well, what is it that you need from your vantage point? And just put in, and it may be that I listed things and actually it's something else, like, thank you so much. So Erin says best practices. Yeah, so we want to hear from you now as a parent, business, state, county. What is it that would help you? So we can look at this and figure out how we can lean in to the particular need around the country. So we'll just take a few minutes. We'll be silent while you sort of ponder this and put it in. Thank you. Yeah, thank you, Heidi. Yeah, so the best practices on the state level and coordination is coming up. Partnering with employers, how to create stairs. So there you go, Sarah, look what you did, not just begin, that's wonderful. Best practices again, parent partnership. And please don't be shy. We want your thoughts, and there's no wrong request. We just need to get a feel for where you are, and we'll take a look at some themes here. Yeah, I agree with you, Chelsea. It's really very helpful, isn't it, to have business sharing how they're experiencing the cliff. When this is just talked about from the context of benefits, it becomes an insular conversation. When it's talked about in the context of economic mobility, economic success, worker shortage, it changes the whole landscape. And it's sort of like going from talking about childcare to school readiness. We need to talk about this not strictly as benefits, but about economic mobility and the worker shortage. Yeah, thank you, David, for weighing in as a dad. We'll take one more minute. Thanks, Kayla. I'm so glad to see the number of parents who are both on panels, but also attending in the audience today. Yeah, again and again, Thalia, we're hearing that the communications is lacking. Thank you very much for that. Yeah, personalized responses to families, Molly, I'm with you 100%. And the whole community, yeah, I think that's right, Peggy. Okay, I now have the honor to introduce you to the two closers of this event. And first, we're going to hear from Amanda Walker Jackson from Missouri, who is the parent who's going to close out this event. Amanda, take it away.
Hello, good afternoon, everybody. This is remarkable that we have over 300 people here today in support of upward mobility of families. I am so gratefully humble and thankful to be here this afternoon and have the undivided attention of the collective. My fellow parent friends, April and Sarah, mentioned that their experiences of being impacted by the benefits cliff, one being what she called punished for mandatory on-the-job training, the other for trying to provide a better living for her and her children. Let me and other parents, like them and other parents, I too suffer from the impact of the benefits cliff. I received a certification in early childhood to try to make above minimum wage. And as soon as my income hit over the allotted amount, I was cut off completely, which led to me having to go to pantries and also homelessness. Today, I am thriving and using my experience to affect improvements for other parents so others do not have to experience what I did. I hope to leave you all this afternoon with empathetic heart and solid understanding that many policies can impact the benefits cliff. Also, I want you to know that I do not doubt that every parent who has spoken on the call wants to work to provide for their families so that they can thrive. But some roadblocks sometimes make it feel impossible to do so. For instance, action is needed to adjust income and asset limits for benefit eligibility. This can help prevent abrupt losses for assistance when individuals start earning more or accumulate modest savings. Another consideration is gradually reducing benefits as income increases, and rather than abruptly cutting them off, can provide a smoother transition for recipients as they become self-sufficient. While there are programs that incentivize work, such as job training, education assistance, and childcare subsidies, sometimes it doesn't make sense to take advantage of them because it may mean that families will lose their benefits that they depend on. What is missing is the bridge to the gap. April talked about how her attending training meant that she had to go 3 months was struggling to try to feed her family on little to nothing. All she wanted was a chance to earn a better living. Sarah talked about how if she took a part-time job, she would lose the medical benefits that were badly needed for her and her child. All she wanted was for her children to have a better life experiences that other children have. We found hope in Kwane's story, but we need to find that kind of hope and intervention across the nation. I close with these thoughts. By advocating for implementing policies that create bridges and lessen gaps, we can work towards reducing the negative impacts of the benefits cliff and supporting individuals and families on their path to economic stability. Let us advocate for policies that provide a safety network without punishing ambition. Let's advocate for policies that provide a smoother transition for individuals as they move beyond assistance programs. Together, we can pave the way for a more equitable society. So please take action now to urge policymakers to prioritize this critical issue. And thank you for listening and thank you for having me. And now let's all go to work.
Well, so thank you so much, Amanda. I love your phrase, without punishing ambition. That seems so important, that this is all about unintentionally punishing ambition. So thank you so much for those beautiful comments and your time. And you just did a beautiful job sort of wrapping a shawl around everybody's core comments today, and particularly highlighting the message of the parents. We will be sending this webinar to everybody here, as well as those who could not get in today. And we'll also be sending materials that were referenced and some additional materials, so you'll all have them. And now I'd like to invite Jennifer Brzezinski to be the other closer to this event. Thank you.
Thank you so much, Elaine. And it's quite an honor to close out this amazing session. I think what I took away, 3 broad themes really stood out to me as we think about solutions: collaboration, patience, and complexity. I think we've really seen that this is a multi-sectoral challenge. It's beyond a whole of government approach. I think so many different, from so many different vantage points, this is compelling, from the strength of our economy and businesses to economic opportunity and stability to child and family well-being. I think it's a challenge that is highly technical, but also extremely human-driven. And I really just can't say how grateful I am to the parents who shared with us today their pain, their experiences, their career goals, how this interferes, and the potential to really excel here. And also keeping us focused that this is about so much more than the amount of benefits or dollars and cents. That from a policy level, we really need to be thinking about much more complex factors like dignity, justice, predictability, communication. And so I think we all are excited to take on that challenge. I think, again, collaboration really stands out. And I know at the federal level, we are really committed to putting ourselves around people and communities rather than living in our silos. My office coordinates something called the Interagency Council on Economic Mobility, which includes many of the federal partners who are here today and many that were not. And we have committed to bringing together some state leaders to start talking with us and other key partners about the feasibility of implementing pilots with additional flexibilities and I think, and also just about how we can keep the conversation going, keep the feedback loop going, and keep the intensity and spotlight on here. The themes of patience and complexity also make me want to share a little bit about the research aspect of this, which we haven't talked about as much, but I think is also really important here. So our office is also really committed to taking a sustained research effort to untangle this. I will tell you, we started trying to model policy changes and think about what levers we could push to get rid of cliffs. And it was a very humbling experience and that we could not figure it out right away. But I can tell you we will, and we're going to keep going at it. But I think we really reflect that experience where when you push one thing, you pull another. And so even just from a very technical perspective, figuring out how to do this is hard. And I want to end by, I think, mentioning something that a mentor of mine once said, and she said, nothing feels better than being part of a team. So while I'm not a patient person and the complexity is daunting, when I think about everyone who spoke today, everyone who took the time to participate today, when I think about the progress that has been made just from that initial meeting in January till now, I am just so excited thinking about what things might look like a year from now, 10 years from now, and to know that we are all in this together and bringing different strengths and committed to bringing about a solution for families. So if I can take a quote from Amanda and say, let's get to work. Thank you.
Now, thank you all for your participation and your understanding and patience. Have a great, great, great night.